All right, let's get right into it. Today we're talking about a real powerhouse drug that doctors reach for when the pressure is quite literally on. We're talking about hydralazine and the art of taming a crisis.
But before we get to the solution, we've got to understand the problem. So what exactly is a hypertensive emergency? It sounds pretty serious, and well, it is.
Basically, it's when blood pressure shoots up to dangerous levels, and I mean fast. We're talking a systolic reading, the top number, of 160 or higher, or a diastolic, the bottom number, of 110 or higher. When you see numbers like these, it is a full-on medical red alert.
Yeah, when the body's systems are under that much strain, every second counts. You can't just sit back and wait. You need something that's going to work and work quickly to get that pressure back out of the danger zone.
And that's where our subject for today makes its entrance. So let's meet Hydralazine, a go-to tool in the emergency kit for exactly these kinds of situations.
So what is this stuff? Hydralazine, which you might also hear called arteries, is a potent antihypertensive. But the key to understanding how it works, its secret sauce, if you will, is one word: vasodilator. That term tells you pretty much everything you need to know. Which, of course, begs the question, vasodilator. What on earth does that actually mean? What's it doing inside the body? So let's pull back the curtain and see how this thing actually does its life-saving work. How does it work its magic?
It's actually a pretty simple and brilliant concept. Hydralazine works by telling the smooth muscles in the walls of your articles, those are your tiny arteries, to just relax. And when they relax, they get wider. This highway analogy is perfect. Imagine your blood flow is a massive traffic jam on a highway. That's the pressure crisis. Hydralazine is like instantly opening up several new lanes. All that backed-up traffic can suddenly flow freely, and the pressure just eases off.
And it works pretty darn fast. When it's given intravenously, it can start kicking in as little as 10 minutes. And the effects can last for up to 12 hours, which gives the medical team a really good window to get the patient stabilized. But here's the thing. A tool this powerful can't be used for just anything. Knowing how it works is only half the battle. You have to know when to use it. And the rules are crystal clear. Its main job is to treat severe hypertension. But the contraindications, the situations where you absolutely should not use it, are just as critical. For someone with coronary artery disease or certain heart valve problems, hydralazine could actually make things much worse. It's a classic case of using the right tool for the right job.
So that naturally brings us to the other side of the coin. With great power comes risk. What are the potential downsides here?
Okay, so let's get into the nitty-gritty. This is where precision and really careful monitoring become absolutely essential for using this drug safely.
You have to be ready to manage these. The most obvious risk is hypotension. That's the drug working a little too well and dropping the pressure too low. The body might also try to compensate with a super fast heart rate, which is called tachycardia. Then you've got the more common stuff like headaches and dizziness. And then there's this really weird, rare one. It can cause the very thing it's supposed to treat, a paradoxical spike in blood pressure. This is exactly why the dosage is so incredibly specific. I mean, just look at the difference. For a general emergency, the starting dose is 10 to 20 milligrams. But for preeclampsia, a really dangerous condition in pregnancy, you start way smaller, with just 5 milligrams, and have a very specific follow-up plan. This is absolutely not a one-size-fits-all medicine.
And the way it's given really reflects that caution. It's not just a quick injection, it's a slow IV push. And the whole time, constantly, the medical team is watching the patient's heart rate and blood pressure. That lets them see the drug's effect in real time and make adjustments as they go.
And this brings us to one of its most critical jobs. As you can see from this official recommendation, in the incredibly high-stakes world of preeclampsia and eclampsia, hydralazine is a vital tool for protecting both the mother and the baby. So what's the actual goal when they're giving this drug? You might think it's to get the blood pressure all the way back to normal, but that's not it at all. The real target is actually this number. The immediate goal is to reduce what's called the mean arterial pressure, the average pressure in the arteries, by about 20 to 25%. The point here is control, not a complete sudden reversal. See, dropping the pressure too fast can be just as dangerous as leaving it too high. It's all about safely and gradually steering the patient out of the danger zone. And that really leaves us with a final thought. Hydralazine is a perfect illustration of the central challenge in emergency medicine. You have this incredibly powerful tool for a fast-moving crisis, but using it requires immense precision and caution. It perfectly frames that question every medical professional has to ask in these moments. How do you balance life-saving power with essential precaution?